Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith-Rogers, and today the podcast heads to Florida. Dr. George Rust is a professor at Florida State University, where he co-directs the Center for Medicine and Public Health. He's also the author of a new book, Healing in a Changing America, Doctoring in a Nation of Needless Suffering. He speaks with Dr. Josh Sharfstein about the state of public health and medicine in Florida, including his frustrations and his reasons for hope. Let's listen.
Dr. George Rust, welcome to Public Health on Call.
Thanks for having me.
I think it might be great just to start by introducing yourself to our audience.
Sure. I'm a family physician by training at Cook County Hospital. Was where I did my residency. I'm also a public health preventive medicine specialist. I've been a clinician working mostly in underserved settings, a clinician teacher, and then a clinician teacher scholar doing research.
Great. And you have a special connection to Florida.
I do. I grew up in Florida. I came back here after training to work in the Farm Worker Health Association. After spending 25 years at Morehouse, I came back to FSU, where I've been on the faculty full-time, but also serving as a public health medical director in county health departments.
So you have a national perspective. You worked across the country in preventive medicine and public health, and now you're back in your home state of Florida.
Yes.
And you're watching public health in Florida.
Yes. In some ways, Florida has either paralleled or even foreshadowed what's been going on at a national level. We started out in the COVID pandemic with very appropriate and aggressive responses that got 95% of our seniors vaccinated with good leadership from our governor. But at some point, politics turned and the national mood turned and everything became polarized. We were emphasizing monoclonal antibodies more than vaccines. There was an ideology that promoted ivermectin and other non-helpful strategies. So we have, in some ways, had a governor that's paralleled the path that our president has followed, and we've had a state surgeon general who, in many ways, foreshadowed what we're seeing with RFK Jr.
And what's been the reaction within the medical and public health fields in Florida as those changes have happened?
Well, many of us are horrified. We've been trying to work in spite of it rather than supported by it. For example, I saw a case of measles in my community here and worked with our public health team to make sure that it didn't become an outbreak. There was a second person in the home who was unvaccinated, susceptible, and had a public-facing job, and leadership level forbid us from using the word quarantine, keeping the person from going to work. We had to work based on trust and helping this person understand that that would not be a good idea. What we're seeing is often public health decisions being made by personal opinion rather than by expert panels.
And most recently, there has been a lot of discussion of vaccination and vaccination requirements for schools in Florida. And this follows a period, I think, when Florida was actually recommending against young people getting the COVID vaccine.
Yes, and again, it's an example of a state surgeon general putting out an opinion about the COVID vaccine related to myocarditis that was a complete misreading of the data, no expert input. And we saw similar things in opinions that were put out and decisions made based on around gender-affirming care and other issues where nobody with the actual expertise was involved in the decision-making. Currently, they are pushing to eliminate school vaccine mandates. Some of those can actually be eliminated by rule at the Department of Health. And so some of that is moving forward for certain vaccines. For things like measles, mumps, rubella vaccine, those are in law, and the legislature has currently not gone along with that, thankfully. But we do see a state surgeon general who is very skeptical about vaccines, and particularly the notion of medical freedom, that everybody gets to decide what they do. I call it the me-all versus the we-all, that individual autonomy is trumping community responsibility. There's no attention to community responsibility. So you can make a decision for your child that endangers my child, and somehow that's okay.
One of the things that I think people outside Florida are wondering is whether these changes really reflect what people in Florida want and are asking for, or whether they're kind of set by the leadership despite maybe views that might be more in line with the rest of the country. And I realize I'm just asking one person and people can have different views on this, but you've been a keen observer. I'm curious what your perspective is on that question.
Well, there are polling data on this so that we have, even across party lines, 70 to 80% support in our state for school vaccine mandates. We all want our kids to be protected. And so I think that's one reason the legislature saw that this was probably not a great path to go down.
And how does this play out within clinics or within communities? Is it very divisive at the community level right now, or is it people are kind of doing what they were doing before, even as these headlines happen?
Well, certainly there's been divisiveness at the local level. I think there's a certain amount of fear, whether it's a school teacher that doesn't know if they're allowed to share that they have a husband rather than a wife because of the anti-woke, anti-DEI kind of a bias here. We also have, in the clinical setting, had significant disruptions to Medicaid and to care for underserved populations. So we have over 1.5 million individuals were dumped off of Medicaid in the past 2 to 3 years. Medicaid disenrollment of people that were really eligible, but because of bureaucratic obstacles couldn't get on it. The ACA subsidies are going to go away for up to 1 million people in Florida. And what that's going to do is create the kind of suffering that I've seen for my whole career. I subtitled the book, Doctoring in a Nation of Needless Suffering. And that's just been something I've seen my whole career is this sad, tragic, unnecessary young people having strokes because they couldn't get their blood pressure medicine, or a woman bleeding out from cervical cancer for lack of a pap smear. And I fear that we're going to see more of that.
Tell me about the measles outbreak in Florida. How is that going? Is that changing people's views? What do you see?
Well, I think both in Florida and nationwide, the only silver lining in the cloud of us having measles outbreaks all over the nation is that it was a fairly rapid feedback loop that said maybe declining vaccination rates aren't a good thing. And so in Florida now we have over 100 cases. Currently, there was a major outbreak at a private college down in Collier County, down in southwest Florida. And what we see is that our vaccination rates for kindergartners have dropped from 95% down to 88%. 2-year-old vaccination rates are even lower. So we are quite vulnerable to having a measles outbreak. And I think people are making that connection. They're saying, gee, we didn't have measles for 20 years, and all of a sudden we're having all these outbreaks all over the country.
Do you think the measles outbreak is one reason why the state legislature didn't go through with removing vaccine requirements despite the governor and surgeon general's support for doing that?
I think so. And there was strong advocacy. Pediatricians and family doctors and public health folks weighed in very strongly on this. Consumer groups weighed in. So I think a lot of things came together. The problem, as you know, with public health and prevention is that when you do it well, the bad thing doesn't happen. And so there are a lot of other things, for example, dropping the requirement for Haemophilus influenza B vaccine, where we won't have such a rapid feedback loop. And those of us who saw that meningitis and sepsis and deaths when we were in training and then didn't see it for decades, it'll take a while for that to start hitting the public consciousness.
You mentioned your book. It's called Healing in a Changing America. You write not just about these problems that we've been talking about, but also about solutions. Tell me what you have in mind.
Well, I realized actually after I came back to FSU that I'd spent my whole career working in underserved settings, diverse settings, but also working in majority-minority institutions, from Cook County Hospital to the Farm Worker Health Association, where my board chair was a migrant farm worker, to Morehouse School of Medicine, a historically Black medical school, and realized that I have had the experiences of what America is trying to become, and they're wonderful. I've had the opportunity to work in settings with a whole bunch of people. And so the book is about lessons I've learned, a lot of mistakes that I've made, skills that I've acquired that I hope are transferable. The solutions, I think, first of all, is just embracing this vision of a multicultural, diverse, multigendered, wonderful rainbow of America that we could become if we choose to. And the second thing is for those of us who came to that from a white norming kind of background. I grew up both in privilege and also in a dysfunctional family. I went to an elite prep school, but I was the janitor at that prep school. So I kind of have a perspective on that. The word healing works on a lot of different levels in the book. It's both about being a doctor and healing in communities where you see this needless suffering. It's also about healing from an organizational perspective. Many of our organizations need racial healing. Historically, white institutions have some progress to make in that space. And then we as a nation have some healing to do. Along the way, I've had some personal healing to do because when you're, as I've said before, that working in the Farm Worker Health Association and taking care of all my patients that had such great needs and admitting them to the hospital, those 6 years were the best 40 years of my life. And if you're not careful, you can really pour your whole heart and soul into that and not realize that maybe you're missing the self-care, maybe you're not taking care of your family. So
Right.
there's some personal healing, I think, that we have to do for those people that are standing in the gap.
What, at this point, as you're looking around Florida specifically, but also the nation, gives you hope?
Wow. And in fact, the last chapter of the book is about hope. First of all, I do see the pendulum starting to swing. Maybe that's too optimistic, but I see cracks forming in some of the polarization that we've had, some of the negativity that we've had. I think people want to return to competence. You wouldn't let a cardiologist do brain surgery. Why is the bar for hiring a surgeon general just whether or not they have an MD or have a license? We have wonderful experts around the country who are trained in public health, who know what they're doing, who have experience of progressive levels of leadership. So I think there is a desire to get back to competence and to rebalance from just me all and a sole focus on individual autonomy to we all. Yes, I can have personal freedom, but I also can look out for my neighbor and have community responsibility as well. And so I think there is some of that movement. I hope that we will come back. I did farm worker health, immigrant health in the Reagan administration, and it was tough times. And we used to say the tide comes in and the tide goes out. And we had to be ready for when the tide changed to be able to move forward.
Dr. George Rust, thank you so much for coming to talk with us on Public Health on Call.
Thank you so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.